All right, welcome back. This time moving on to Chapter 18, Plyometric Training. Like I said last time, the setup of the textbook's a little weird here that we did the program designed for strength training stuff after talking about like strongman training and that sort of thing. Chapters 16 and 18 are pretty similar in terms of they're going to discuss kind of the rationale for the exercise, and then they both have a supplement, as do some of the later chapters that we're about to get to. So we're going to cover the rationale for plyometric training. We're going to cover what happens during plyometric training. And then there's a separate supplement that you've probably seen that includes a variety of different plyometric training exercises. There are also some tables that are embedded in the lecture that include some plyometric training exercises that you can incorporate into your program as well. All right, so one of the things I should probably mention here at the outset is what plyometric training is. So plyometrics are any sort of a motion where there is a rapid stretch of the muscle followed by a rapid contraction. So a lot of the movements that we do in sport anyway are plyometric movements. So for example, if we're thinking about somebody like a baseball pitcher, whenever they go into the windup where their arm goes into full external rotation, they're going to do that motion really, really quickly, and so by doing that, you're going to get a rapid stretch of all the internal rotators of the shoulder, so pec major, lats, subscapularis, etc. And so that rapid stretch facilitates a stronger contraction as they go from stretch, so from, not really eccentric, but so from stretch to concentric. That's going to facilitate a stronger concentric or shortening contraction as they go to accelerate the ball, and so that then will help them to throw harder, right? So most of the movements that we do in sports involve some sort of a counter movement like that. So in baseball, the counter movement is the windup, that bringing the arm into external rotation. Same kind of a thing with the serve in tennis or volleyball. And then if we're doing something like jumping, we're going to have, or the athlete will drop into a quick squat and then jump right up, right? And so the counter movement is that quick squat where they drop into hip flexion and knee flexion really quickly to facilitate hip extension and knee extension. So that's what plyometric movements are. Rapid stretch followed by rapid contraction. So why we do those things is because the muscles and the tendons are elastic. So remember that if a tissue, or anything, but in this case a tissue, if a tissue is elastic, what that means is that the tissue is able to be deformed and then return to its original configuration. So in the case of muscles and tendons, they're capable of resisting stretch and then snapping back to their original length. And so what we're doing with those quick movements then is we're taking advantage of that elastic property. We're basically stretching the muscle out like a rubber band, and on the rebound, as it returns back to its original configuration, that's helping us to propel the baseball in the first example. So that's what we're trying to do there. So from a mechanical standpoint, we're taking advantage of the elasticity of the musculotendinous unit. And then we're going to break that down a little bit more. This diagram and this terminology isn't as complicated as it may look at first glance. So you have a few different components here. So the first one is the serial elastic component. And so the serial elastic component is the tendon. So remember that a muscle's tendon, so muscles insert into bones via tendons, and that a muscle's tendon has both collagen and elastic fibers in it. And so those elastic fibers are the ones that really snap back to the original length. And so the serial elastic component then is the tendon of a muscle. Then we also have the parallel elastic component. And so the parallel elastic component is those three layers of connective tissue that we talked about when we talked about muscle anatomy. So those three layers of connective tissue are the epimysium, the paramysium, and the endomysium. Remember that the epimysium is a layer of connective tissue that wraps around the entire muscle. The paramysium is a layer of connective tissue that wraps around a bundle of muscle cells, also known as a fascicle. And then the endomysium is a layer of connective tissue that wraps around an individual muscle fiber. And this textbook also throws the sarcolemma, which is the muscle cell's membrane, in there as part of that parallel elastic component. And then the last component of this is our contractile component, the CC. So this is supposed to be myosin here, and then the little, I guess that's yellow. The little yellow things there are supposed to be your actin. So remember that the way that muscle cells shorten is that myosin will attach to actin, pull it toward the midline. That causes the sarcomere to shorten, and then if we shorten sarcomeres throughout a muscle cell and then throughout an entire muscle, then we pull the origin toward the, pull the insertion toward the origin of a muscle, and then we get muscle shortening. So the contractile component then, actin and myosin, and the cross bridges that they form. So what happens then is that when we stretch a muscle really quickly, we're going to get a stretch of the tendon, which is the series elastic component, and a stretch of the parallel elastic component, so those 3 layers of connective tissue inside of and around the muscle. And so that rapid stretch then, if we release that stretch, so if we engage a concentric contraction, if we release that stretch, those components, parallel elastic and series elastic component, are going to snap back to their original length, and that's going to help increase force production as we move the arm into internal rotation, sticking with the baseball throw example. And in addition to that, we have the contractile component. So that is the voluntary contraction that we get whenever we intentionally contract the muscle. So you get this combination of intentional contraction, so the contractile component, you'll get interaction of actin and myosin, that's going to cause the muscle to shorten, and then that is augmented by or helped by the return to shape or the elasticity of both the parallel elastic component and the serial elastic component, or series elastic component. So that's the mechanical model. So the gist of it is we stretch a muscle really quickly. Both of those elastic components are going to be stretched. They're going to snap back to their original shape. That helps facilitate, again, that concentric contraction, the internal rotation of the arm on the throw. And then if we combine that, again, with that intentional voluntary contraction of the muscle, then those 2 or 3 things together add up to a stronger contraction, a more explosive movement. The neurophysiological model, now we're getting the muscle spindles involved in this stronger contraction. So we've talked about the stretch reflex before. In previous chapters, it was referred to as the myotatic reflex. So that is, again, modulated by the muscle spindles. So, and you've seen a very similar diagram to this before, not this exact one, but a very similar one. So remember that the muscle spindles are intrafusal fibers. They're fibers inside of the muscle, and they are basically modified muscle fibers. They have a sensory area in the middle, so that can be, it's a bunch of nuclei in there. The nuclei can either be kind of like all around each other in the case of a bag fiber, or they can be lined up end to end in the case of a chain fiber. For right now, that part doesn't really matter, but that middle section where all the nuclei are clustered is surrounded by sensory neurons. And so, or the terminals, actually technically this would be dendrites. So the dendrites of sensory neurons. And so when the muscle spindle is stretched really quickly, that's going to cause depolarization of this neuron. And so it's going to send an electrical signal back to, this is the dorsal root ganglion, but that doesn't really matter. But anyway, we're going to send our electrical signal back into the posterior aspect of the spinal cord. That's what this thing is a spinal cord. That sensory neuron is going to synapse with a motor neuron that's going to cause reflexive muscle contraction. So effectively, if the muscle is stretched too fast, that causes this sensory signal saying, hey, muscle's being stretched too fast, we need to protect it. Oh, okay, we'll protect it by initiating muscle contraction to keep the muscle from being overstretched. So that's what a stretch reflex is. So reflexively, if you stretch a muscle really quickly, you're going to get this involuntary, which is what a reflex is, you're going to get this involuntary contraction of the muscle. Again, that's basically a protective mechanism. So in terms of plyometric or ballistic type movements, not only do we get the mechanical aspect of it where we stretch the elastic components and then we get their rebound, but we also get, by stretching the muscle really quickly, we involve the nervous system. We stimulate the muscle spindles that, again, are going to sense that the muscle is being stretched really fast. They cause a protective contraction to limit the rate and degree of muscle stretch to try to keep the muscle from being overstretched and tearing. And so, again, the example that you see, like the classic example of the stretch reflex is if you go to the doctor's office for physical, like a sports physical or something, and if you're seated on the table, or if a patient is seated on the table and the physician taps on their patellar tendon with the little reflex hammer. What you're going to get when they tap on the patellar tendon is a quick stretch of the quadriceps group, because the patellar tendon is the tendon of insertion of the quad group. And that quick stretch then is picked up by the muscle spindles, causes a reflex contraction, which means that the patient then involuntarily extends their knee if their reflexes are working normally. And so if we combine that involuntary muscle contraction that's caused by stretching the muscle really quickly with the elastic component plus the voluntary contraction, then we get this really big, really explosive movement. So that's how a baseball pitcher can internally rotate their arm at more than 6,000 degrees per second, is because of adding up all of those different factors: the elasticity, the voluntary contraction, and the involuntary contraction stimulated by the muscle spindles. So there we're referring to the stretch shortening cycle. So the stretch shortening cycle, this book breaks it down into 3 phases. There's the eccentric phase, which is the stretch of the agonist muscle. So I'm going to switch examples here to dorsal and plantar flexion. So hopefully you'll recall that plantar flexion is when you come up on your tippy toes, and then dorsiflexion is when you bring the top of your foot toward your shin. So if you're stretching your calf, that's a dorsiflexion type of a motion. So eccentric then is a stretch of the agonist. The amortization phase is not as complicated as it sounds. We'll actually set that aside for a second. Then we'll go to the concentric phase, which is where the muscle is contracting and shortening. And so the amortization phase is just the time between the muscle being stretched and the muscle being shortened. So that then is the amortization phase. So typically that's ground contact. So if we're thinking about somebody doing, let's say like one-legged hops. So they're going to hit the ground on the ball of their foot, right? So near the metatarsal heads. That's going to force the foot into dorsiflexion. So now once they hit the ground, that's ground contact time. It's going to force the foot into dorsiflexion, so we get the eccentric phase, and then there's going to be a split-second delay until they hop into the next step or into the next box if they're doing an agility ladder. And so that, again, that period between the stretch of the muscle and then the contraction of the muscle is going to be the amortization phase. And actually, so that's an important thing to mention here, is we want to minimize that. Because the longer the amortization phase or the longer the ground contact, what that does is that we lose some of that elastic energy both in the tendon and in the parallel elastic component. Basically, those stretched structures end up just giving off that energy as heat if the amortization phase or if the ground contact phase is too long. So one of the things that we want to emphasize when athletes are doing plyometric training is quick transition times. So hit the ground and go, hit the ground and go, hit the ground and go. It has to be really fast type movements. If they kind of hit the ground and stay there for a second and then jump, that entirely defeats the purpose. So we want these to be really fast movements with minimal ground contact time, or using this terminology, with a very short amortization phase. So here you can see that example I was kind of mentioning a second ago. So this is an individual doing a long jump. So you can see as the ball of his foot or his metatarsal heads hit the ground, we're going to get an eccentric contraction of the calf musculature, so gastroc and soleus primarily. And then, so they're going to rapidly stretch, so building up that elastic energy in the Achilles tendon and in the epiperi and endomysium of those muscles. That rapid stretch is going to stimulate the muscle spindles in those muscles, and so then we get the voluntary contraction plus the stretch reflex plus the elastic rebound of the different elastic components, so the SEC and the PEC. And then that'll help this athlete jump farther. So that's the stretch shortening cycle, going from the eccentric amortization phase to the concentric. All right, so if you're going to design a plyometric program, obviously the first thing that you would do is a needs analysis. So what is the sport, what's the position, what's their training status? Training status will be particularly important. We can do, and we do, incorporate plyometrics into the training of younger and less experienced athletes, but they tend to be lower intensity plyometrics. They tend to do like lots of hopping. For your young soccer athletes, we're not going to do a lot of like lunge jumps with them or pikes, or there's a bunch of other like higher intensity stuff that we're obviously not going to do with them. So training status is a big portion of this. And then, sport position. So if we've got like a soccer athlete, obviously they're going to spend a lot of time doing lower body plyometrics, not a ton of time doing things like clap push-ups you can have them do some core stuff, some rotational stuff, but as you'll see here in a second, most of the core type movements that we do aren't really plyometric. So typically what people describe as being core plyometrics are things like medicine ball throws. So if you're standing, like facing the wall and you're holding a big soft medicine ball and you bring it to your right and then rotate and throw it into the wall and then, that kind of thing, that's kind of plyometric, but typically the range of motion is a little bit too large for most people, so it's not a true plyometric motion, but that's more an issue of semantics. All right, so lower body plyometrics. Virtually all of our athletes are going to engage their lower body in a plyometric fashion because most of the sports that athletes participate in involve running. So obviously not all, but most sports are going to involve running. And so because of that, whether it's volleyball, basketball, tennis, football, soccer, etc., they're all going to involve some level of lower body plyometrics. So rapid stretch of the ankle, rapid stretch of the knee, hip, etc. So there's a variety of different drills that you can do for that. And some of those are listed here. Like I said, some of those, there's a lot of those in the supplement, and then there are quite a few more that you could do, but the supplement will give you some good starting points. Upper body stuff. So typical upper body stuff includes medicine ball throws, and then those are also oftentimes grouped into trunk plyometrics. Medicine ball catches. So medicine ball catches, usually it is somebody throws it to you, you catch it, rotate, and then throw it back. But they can be where somebody is, if your hands are out in front of you, kind of like a chest pass in basketball, somebody throws it at you and you catch it and then immediately pass it back. That would count as well. And then different kinds of push-ups, where you do like clap push-ups are the most common. You can also do it with a Smith machine, which is where the bar is attached to two poles that are vertical, and the bar just kind of slides up and down on those poles. So you can do various like throwing kind of things, so like explosive bench press kind of stuff. You can do that with the Smith machine. So you do it like just with the bar, maybe the bar in 10 is pretty lightweight, and you genuinely throw it. You push it up off your chest, you let go of the bar, and then you have to be able to catch it when it comes back down. So that would be another example of plyometrics. And I talked about all the trunk stuff. So the intensity of the plyometrics. So ways to gauge the intensity. One is the number of points of contact. So obviously, one-legged plyometrics, so hops are more intense. So single-leg hops are more intense than bunny hops, for example. So if you reduce the number of points of contact, it becomes more intense for that one leg or that one arm. Speed of them. So if we do, let's say we're doing the agility ladder and we have them do hop down and back, really, really quickly, minimize ground contact time, lots of repetitions. That's something that's going to make it more intense. The height of the drill. So if we're thinking about box jumps. So with box jumps, you want them to be able to jump off a box, hit the ground in as little time as possible, and then jump back up. And so the higher the box, the more intense the drill because they have to absorb more impact forces. So, because they fall from farther, they fall from 30 inches as opposed to 12 inches, for example. And then the last one on there is their body weight. The larger the athlete, the more intense the exercise. So think about, like football offensive linemen who weigh more than 300 pounds versus your defensive backs who may be more like 180. If they're both doing box jumps, the exercise is much more intense for the offensive lineman because they have to absorb a lot more weight because they're a lot bigger person when they hit the ground. So that's an increased intensity there. So, and just like we talked about in the periodization class or in the program design class, so typically when intensity goes up, so if we're jumping off of high boxes, volume goes down. So the number of repetitions that they do goes down. So there is an inverse relationship still between intensity and volume. In terms of frequency, so you want to have 2 to 3 rest days between plyometric sessions. Now it doesn't, so if we're talking lower body plyometrics, we're having 2 to 3 rest days between, but that doesn't mean you can't do upper body plyometrics the very next day. So you could do lower, upper, and then take 2 days off, for example, and then go back to lower if you wanted. But the key point here is should be 48 to 72 hours, typo on my part. So 48 to 72 hours between plyometric sessions. Typically athletes will perform 2 to 3 sessions a week, but it depends upon the time of the year. So obviously, in the early off season, they may actually not be doing any plyometrics. And then as we get closer to the season and their training gets more specific to the needs of the sport, then they'll incorporate more training sessions. And then obviously in season, maybe as few as 1. So it can be as few as 0 early in the off season or during the transition phase. Maybe we'll ramp up to 1 or 2 in kind of that late general preparatory phase. As we get into specific prep, now maybe we're doing 3 and 4 sessions a week, and then the number of sessions will probably go down during the season just because you don't have time, but also because they're doing a bunch of skills practice for their sport. So recovery between bouts or between reps. So you can see that if we're doing depth jumps, so if somebody is dropping off a box and jumping up as high as they can, you want to wait 5 to 10 seconds between repetitions, because what we're trying to do there is to improve their power output. And so improving power requires really high quality repetitions with long rest periods. So you may see long rest periods there, and then like it says, 2 to 3 minutes between sets. If we do a bunch of things, a bunch of plyometrics back to back to back, that becomes more of a test of the aerobic system. And we're not going to get as high of a power output, and we're not going to get as high quality of reps. So just something to be aware of. If you're really doing plyometrics to be explosive, you're going to have to do long rest times between. What else? Same stuff. In terms of volume, this is a really handy table. So this is the number of ground contacts. It doesn't say ground, but typically it's ground contacts. So usually, because most of the plyometrics that our athletes are going to do are lower body. So like I said, lots of hops, jumps, agility ladder, that kind of stuff. So 80 to 100 ground contacts per session for a beginner. And then as they become more advanced, we can bump that up to 100 to 120. And then really advanced athletes, 120 to 140. So like I said, handy little chart there. It's a good thing to be familiar with because you'll probably see a question about that on the quiz for this, but also that's one of the things they like to ask about on the NSCA exam. I was going to comment on the ground contacts thing. So obviously if you're doing, like plyometric throws, that's not technically ground contacts, but the basic guidelines are the same. So just like anything else, there is progression. So you start with a relatively low number and then work your way up to higher, or relatively low volume, work your way up to a higher volume. So you don't want to have athletes go from doing nothing to doing 140 ground contacts, then you're going to get an injury. So that may be some growth plate irritation, like an apophysitis in your adolescent athletes, or that may be tendonitis in your older athletes. Length of the program, so most of them are 6 to 10 weeks. Now that's on an experimental basis. But you can see improvements in vertical jump after 4. So you'll see improvements in power production after as little as 4 weeks. As mentioned, we want to progress athletes, and so that includes not only the overall volume of the program, but also the intensity. So you want to have athletes start with lower intensity stuff, so have them start with various hops and then work their way up to different kind of larger jumps, so like tuck jumps, and then they'll work their way into lunge jumps, and then into box jumps or depth jumps. So that's kind of a basic progression for those. We don't want to have athletes start with depth jumps because those are pretty high intensity. So you're going from 0 to 60 right away. And so again, that could lead to injury if we jump straight into something, no pun intended, if we jump straight into something that is such high intensity. All this stuff is the same as it is for every other workout. So you'd want to do a general warm-up. You obviously don't want to do a lot of jumping without warming up first. You can stretch. I'm surprised they included that, if I'm honest, because stretching reduces power output. So I would say skip the stretching and just do general warm-up and specific warm-up, and then stretch afterwards if you want. And then other things, so with adolescents, so just one thing to keep in mind with them, two related things. One is that under some of the larger tendons, they're going to have growth plates, so those are the apophyses. So for example, underneath the insertion of the patellar tendon into the tibial tuberosity, you've got an apophysis there. And so with really big explosive quad contractions, the patellar tendon can pull away from that insertion a little bit. And so that's called Osgood-Schlatters disease. We talked about that in a couple classes. And so with that, if you have your athletes doing a lot of like really high intensity jumping, box jumps and lunge jumps and that kind of stuff, frog jumps, if you have them doing those kinds of things, that can cause irritation and inflammation at those insertion sites. So we want to be careful, particularly with the adolescent athletes, of overdoing it, both with respect to intensity and volume. And then, let's go with that. So yeah, especially with them, start them out with lower intensity stuff and work your way up. Masters athletes, so remember that the tendons lose fibroblasts as we age. So the fibroblasts are the ones that generate the collagen. They play a really important role in tendon repair, and so our tendons are just less able to repair themselves with age due to decreased fibroblasts, but also due to decreased capillary density in the tendons. So tendons aren't super vascular anyway, and they become less vascular across the lifespan. And so what all that means then is if we put a lot of stress on the tendon in our older athletes, so 30 plus, then they may not be able to recover quite as quickly, and so they may develop a tendonitis. So just something to be aware of with that. So progression is especially important with the masters athletes so that we don't overload the tendon too early on and then have them develop a tendonitis that'll be hard to recover from. So you want to have them take 3 to 4 days between plyometric workouts with our older athletes. If we're going to combine plyometrics and resistance training, one of the ways to do that is here. So you got upper body training, so that like bench press and stuff here, and then the plyometric session would be lower body stuff. So have them do jumps and agility ladder and all that stuff. And then on Tuesday, then we'll have them do heavy squats and all that stuff, and then the throws. So you're not doing a bunch of squats and then jumps on the same day. So just something to be aware of there. There is a type of training that incorporates both at the same time, both heavy resistance training and plyometric training. It's called complex training. And so basically what you'll do there is do something like relatively heavy squats. So typically your 5 rep max or lower. So 87% plus of your 1 repetition max, so pretty heavy weights. And then so you'll do, let's say, a set of 5 heavy squats, and then as soon as you rack the weight, you're going to have them do some box jumps, or maybe even just one really big explosive jump onto a relatively high box. That's complex training. So the idea there is training the nervous system. So we're going to have them during the squat recruit all of their motor units, and then we're going to recruit them at a higher rate, recruit them again and at a higher rate during that big explosive jump. So that's the idea behind complex training. I didn't know this was going to be a GIF. I thought that was going to be a still picture, but that's cool. Got a little GIF. So if you're combining plyometric and aerobic exercise, just remember that aerobic exercise tends to reduce power output, so you do your plyometrics first, followed by your aerobic stuff. And then in terms of safety considerations, so the big ones here are technique. Make sure that they can land appropriately, with their knees in line over their feet, that their knees aren't buckling medially, which is pretty common, that they can land with their knees flexed, that they don't land fairly straight-legged, that they get good flexion at the hips when they land, nice flat low back when they land, those kinds of things. Here's the ideal landing position demonstrated here. So again, flexion in the knees are straight over her feet. You can see she has a nice flat low back, but also flat throughout the spine. And then, fairly neutral neck position as well. So that's the landing position that we're looking for there. If athletes can't do this, then we certainly would want to avoid higher intensity stuff, so box jumping and stuff. Here's a bad landing. So you can see this guy landing, so that you got big valgus knee angle here. You got external rotation of the tibia. So that's a landing position that's going to put this athlete or this individual at a fairly high risk of ACL sprain. So we want to fix this before we do much jumping, because we don't want this individual to tear his ACL during our drills. That'd be bad. So the book has changed some. Of the recommendations from the NSCA have changed some. It used to just be they had to be able to squat 1.5 times body weight, and then they could do plyometrics. Now they've put a few more caveats on there that really the important thing is their form. And so if their form is right, even if they can't squat 1.5 times body weight, they can still do some lower intensity plyometrics. And then the other thing there is obviously kids can't squat 1.5 times body weight, but plyometric training is still appropriate for kids to be able to learn how to absorb their own body weight, and also from a motor unit recruitment standpoint. So even though our U10 or U8 soccer players aren't heavy squatters, they should still be doing some hopping and some jumping for the reasons I mentioned. Balance stuff. So in terms of the evaluation of the athlete, rather than looking at squat strength, you can also evaluate their balance. And here's different ways to do that. I won't belabor that point. Something to keep in mind from an intensity standpoint, so your larger athletes, those who weigh more than 220 pounds, might be at increased risk of injury when performing plyometric exercises, particularly high intensity ones like depth jumps or box jumps, or things like lunge jumps. They're more likely to be injured during those things. So just for those athletes then, you're probably going to want them to have a little bit lower volume. Other things, landing surface. So if we have athletes doing these things on a really soft surface, that's going to lengthen the amortization phase. It's going to lengthen ground contact time, and so that makes the plyometrics a little less effective. So we do want them to be on fairly firm surfaces, which may include the type of surface that they compete on, so maybe like an AstroTurf field, grass field, on the track. Those are all good choices, but we don't want them doing them like on gym mats, for example, that are really thick, that are made to absorb shock. We don't want that because they're not going to, like I said, you're not going to get a short amortization phase with that. Training area depends on what drills you're doing. So, you can do a lot of plyometric stuff in a really confined space. I imagine at some point you've all seen where there are dots painted on the floor, like a set of 5 dots is fairly common. And so, you can do that in basically like a 3x3 space. Or if we're having athletes do things like skipping and bounding and all that stuff, obviously we need a lot longer runway. So the amount of space required depends upon what sort of exercises you're doing. In terms of equipment, so boxes, the height on the boxes can range quite a bit. You also see people now doing a lot of things where they're like jumping onto bumper plates to see how high they can jump. Seems kind of risky to me, but I know that's a thing. But the boxes can range anywhere between 6 and 42 inches. But you'll see the standard recommendation on the next slide. Proper footwear, wear normal exercise shoes, supervision, make sure we monitor them. Here we go. So in terms of depth jumping, so this is a lady doing a depth jump or a box jump. So typical box height, somewhere between 16 to 42 inches, but typically 30 to 32 is the norm. And so if we got athletes that are really large, so over 220 pounds, we're going to bring the box down a little bit and have them only jump off of 18 inches or less. So that's another number, in addition to the ground contacts to be familiar with, is if you have larger athletes, the box height that they should jump off of. And that is it. So then next time we're going to talk about agility training, so we'll see you next week.